My name's Abid Hussain. I've been a podiatrist for 23 years. Always had a passion of taking care of feet as well as diabetic feet. I was approached by Aisha and a couple of my colleagues to come to Pakistan to take care of diabetic feet. And it really got me thinking about diabetic feet. Diabetes in general is a worldwide problem. There's 450 million diabetics in the entire world, and that's been growing at an exponential rate. It was 108 million in the 1980s. It's grown quite a bit. Every 30 seconds there's an amputation in the world because of diabetes. We know in Pakistan there's approximately 35.3 million, and but we don't know for sure how many diabetics there are, because there's no centralized database regarding diabetes within Pakistan. We know 150,000 people have their foot amputated every year. That's such a large number, and this is from problems that can be easily prevented rather. So I was approached by Aisha and a couple of my colleagues to come here, and I really wanted to make sure that this would be a more comprehensive treatment and comprehensive plan that we had in place, rather than just coming for a few camps. So we need to, while we have been here, we've seen 400 diabetic patients. We've seen many patients who did not know they had diabetes. We've seen other patients whose diabetes was out of control. So we've given a lot of advice. We've also treated ulcers. We've also found a case of osteomyelitis, which we have sent on to the appropriate referral pathway. We've all got a passion to try and reduce the number of amputations that are occurring here in Pakistan. We realize that we need to do more camps within Pakistan. We need to come back to Pakistan with other UK trained podiatrists. We need a group of at least 10 to 15 podiatrists at a minimum to do a vast number of camps and treat a few thousand people rather than a few hundred people. However, we realize that we need to train existing healthcare professionals and also train new diabetic foot care assistants. So we've created a training program for diabetic foot care assistants, as well as medics and nurses within Pakistan, which we hope to implement. We've had some really good feedback from a few diabetic hospitals, and it's something that I have so much passion towards, because this will be something lasting, and this will enable the existing infrastructure, healthcare infrastructure, to be able to screen and treat diabetic foot conditions appropriately. There are no trained podiatrists in the whole of Pakistan. You can imagine that there's 200 million people. There's no trained podiatrists in the whole of Pakistan. People do a 1-week course and then they try and treat a diabetic foot ulceration, or they try and give some advice regarding diabetes. There is no public health awareness campaign within Pakistan regarding diabetes and foot care. Now, all four of us have an enormous amount of passion towards this, which is why we created the International Podiatric Medical Association. But we need more people, we need more help. We need help from podiatrists, we need help from government health officials, we need help to be able to make a lasting difference within Pakistan. They do not have the infrastructure that we have in the UK, which is an amazing infrastructure. We need to help the government of Pakistan to create that awareness campaign, create the Feet First campaign, create the infrastructure that is required, which is what we inshallah will try and do. So I will request two things. I would request the Pakistani government to try and help us as much as possible, and I would request that any UK podiatrists who are listening to this, who can spare a week or two every year to come out and help us. It is an interesting experience, but it is also a rewarding experience also.